All right. Hello, everyone. Welcome to School of Speech. School of Speech is presented by Speech Therapy PD. I want to thank everyone that's joining us today, and a special welcome to those that are joining us on Speech Therapy PD's YouTube channel. I'm Carolyn Dolby, and I am your host of School of Speech. Love it. I am a practicing school-based SLP, and I love doing this every week. Today's episode is titled Successful Stuttering Therapy in the Schools, and I have not one, but two special guests. Yes, a husband and wife duo this week, Joe and Holly Klein. So excited. Dr. Joe Klein is an associate professor in communication sciences and disorders at Eastern Washington University in Spokane. Joe has published articles and presented nationally and internationally about stuttering and people who stutter. Joe is also the co-director of the Successful Stuttering Therapy Program for teenagers and adults in an intensive residential therapy program. And Holly Klein, his lovely wife, has been a school-based speech pathologist for over 25 years, and she's currently serving at the middle school level for Spokane Public Schools. So we are going to settle in for another amazing episode. I do have just a few things to mention. The first, and a very important one, is that each episode is offered for 0.1 ASHA CEUs. Oh, I do need to do the disclosures. Joe receives a salary from Eastern Washington University, and Holly receives a salary from Spokane Public Schools. And the clients will both be receiving an honorarium from Speech Therapy PD for this presentation. They both do not have non-financials to disclose. For me, I am salaried at Portland Public Schools. I also am compensated for the graduate courses I teach, as well as I am compensated from Speech Therapy PD for my dream job, which is hosting School of Speech. Non-financial, I do consult across the nation supporting dysphagia program development and staff hiring, staff training. And I'm also a member of ASHA's special interest groups 13, 14, and 16. Enough about me. I want you guys to meet my amazing guests. Hey, Joe. Hey, Holly.
Hey, Carolyn, thank you so much.
I am so excited that you guys are here. And I would love to start if you would just give us your journey. Tell us how you became speech pathologists. What happened?
Holly, do you want to go first?
Yeah, I'll start. So I was an undergrad student and could not figure out what I wanted to do and happened to just show up at a social event and met two graduate students in the speech pathology program at the University of South Alabama, where I was in school as an undergrad, and knew right away it was a way I could work with children, still be in a school, but I knew that I probably did not want to run a classroom all day long. So, and I also liked the medical aspect of what we do as well. So it appealed to my medical brain, but also my science brain, but also my desire to want to be in schools and teach. So that's kind of my journey.
Bless you. Love it.
And then mine might be a little bit longer if that's okay, but I think it
Absolutely.
has a lot to do with what we're talking about today. So I'm a person who stutters. I started stuttering pretty typically around age 3. And then first time I ever remember stuttering, like remember that I was someone who stuttered, was when I was in first grade and I was pulled out of class along with 2 other kids. And we went with this woman I'd never seen before into this little room. And the 2 other kids said what the speech therapist would do would just kind of hold up pictures. And the other 2 kids would kind of say the words a little bit funny. But then it got to me and I couldn't really say some of the words. And so I immediately was thinking like, wow, okay, there's obviously something wrong with all of us if we get pulled out of class to look at pictures, but there's something really wrong with me. And then apparently we had therapy all year. I have no memory of that. And things went so well that I got pulled off caseload. Really have great memories of my second grade year. And then in third grade, my stuttering just came back. It just came back out of nowhere and came back really hard. And I really quickly shut down, stopped talking, stopped raising my hand. In first and second grade, I was the kid that was held. I wasn't allowed to go to recess because I was talking so much to all my friends. And now the opposite was sort of happening, where I stopped talking, stopped raising my hand, stopped participating. My parents got me into private therapy in 3rd grade. And I remember we went to this woman's house and she had a cute little dog and we practiced easy onsets. And I remember practicing that, but as a 3rd grader, I'm not sure any 9-year-olds want to go around talking like that. I mean, I just wasn't, I could do it really well in the therapy room, but then would never do it, never did it one time in my whole life. I don't think after that. So then I got therapy at school and I just remember reading, like I would get pulled out of class and I would practice reading and reading slowly. And that again, there wasn't any carryover. I felt like I didn't really understand what we were doing or what we were working on. And I also just really hated my stuttering. So the last thing I wanted to do was to go, leave for half an hour and think about my stuttering when that's all to me, that was the worst thing in the world. So I didn't want to do that. So I just kind of stopped going to speech therapy. And honestly, it really wasn't then until after college that, I graduated college and kind of had an anxiety attack that I was a, severe stutterer. And I ended up majoring in philosophy because I'd wanted to be a journalist. I wanted to major in journalism, but I felt like I couldn't talk. I felt like I couldn't use the phone. I felt like I couldn't, say my name. And so I majored in something where, I really for the department I was in, we really just had to read and write papers. And I felt like I could do that. So, but then I graduated and kind of had a nervous breakdown that I was a severe stutterer with a philosophy degree and didn't know what to do. And so I had my mom, and my mom had found a speech therapist for me, and she actually called the speech therapist. I was a 22-year-old, and I didn't use the phone, and she called a speech therapist, and I went to see a private speech therapist and went to his house, and that just completely changed everything for me. And what I realized from that therapy was that I had never learned anything about stuttering. No one had ever taught me about stuttering. No one had ever taught me about the kinds of stuttering there was or how many people stuttered or anything. We always just worked on fluency. So now all of a sudden I got to learn about stuttering. I got to practice my stuttering. I got to, I was told and challenged to stutter on purpose and to kind of go out into situations and stutter, which I was horrified by. But then when I did it, it ended up being so freeing for me that I had this thing that I was trying to hide from people for so long. And I would just kind of pretend like I didn't stutter, and I would change words and I would be quiet or I would do different things. And, then to be able to just stutter and even do it on purpose was just so freeing for me. And so I actually remember one night I was driving home from speech therapy and I was like, I want to be a speech therapist. Like I want to have the impact on somebody that my speech therapist had on me, because it not only changed my speech, but it changed the way I thought about speaking, the way I thought about myself, the way I, related with other people. Like it had such a big impact on me. So that really was my journey.
I love that. I love the story. I'm sad, that's how your journey but I'll tell you what, mine's sort of similar, not with stuttering, but I came from Australia and I had this accent, and I'll never forget, in my 4th grade, teacher stopped me and would say, I remember the word, it was there. And I would say there, and she'd say it again, say it again, say it again, to the point I shut down and I refused to read out loud and speak in class all the way until college too. So
Wow.
I know. So it's like, and so that's what drove me to become a teacher. I was a teacher before I became a speech path, because I never wanted a student to go through what I went through. So I'm not that I'm wanting all of us to have, a trauma, but I mean, it's interesting what brings us to where we are. So, and I'm sure your unique perspective is something that you are able to share. And I can't wait to hear more. So enough about me. I need to stop talking. I want to know more about what we should be doing. Stuttering, some I guess I could have asked those that are listening, how many stutterers do you currently have on your caseload? I'd love to know that. So if you guys out there in the listening world, our live little audience, let me know if you've got how many you have on your caseload. Oh, they're jumping in. So please jump in. Tell me if you are in a full caseload. We've got 5, 2, 1, 2, 1. 3311. So and I'm assuming that when we're talking about a full caseload, we're talking upwards of 50, 60 kids. So out of that many kids, one. So it's a low, maybe more of a low incidence that we see. So maybe we don't always have one every year either. So all that you can help us with today, I want to know goals personally, because when you were talking about that easy onset, especially when you were in first grade, how that didn't mean anything to you. So could we, okay. Where do you, I want to talk about goals. So where would you want to start talking about goals?
I think I want to start with, on the school side of it, I want to
Okay.
start with how Joe and I came to this conversation.
Perfect. Okay.
So I think for me, I was really struggling, and in 25 years, and I've had maybe 4 or 5 on my caseload, and I've
Yeah.
carried caseloads of around 50 on average. So that, yeah, you're not getting high incidence. And then you're getting, for me, I was getting different grade levels. And what does that look like? And how does that feel? And very, very trained in, young children. But what does it look like when they get older? And we still have this persistent thing. So how we came to this was, I was looking at billing codes, because as a school speech therapist, I've always been a Medicaid biller as well. And when you look at them, they're very clinical. And it was how, we'd have these conversations about, how do I marry this very clinical goal, which great, just like what Joe was talking about. I could pull them into my room. We could do easy onsets. We could even practice in my room pseudo stuttering. We could, practice cancellations. We could do all the things. And then there was no desire from any of my students at any age level to want to push that outside of the room. We would do some, I guess the best I was doing at that point was just, I would stutter in front of the child so that they could feel more comfortable. And then from there, maybe we'd go to the office and try it out once or twice, but it felt very contrived, and it felt not functional. And so we started having these conversations, and that's kind of how we got to this point. We're like, what does this look like in the school? You can go to all these great stuttering workshops as well, and they talk about it from very clinical. We take the kids out to ice cream. We order ice cream. I was like, okay, that's not happening here at school.
Right.
We're not getting in the car and going for ice cream. So how do we impact these students where they spend the vast majority of their week for at least 180 days a year, right?
Yeah.
So that's kind of how we got started on our journey with our conversation. Yeah, Joe, you want to chime in there?
Yeah, I guess you kind of started like what is maybe the start is, what is our purpose in the schools?
Yes.
That might be a good start. What is our purpose in the schools with students?
Yeah, and I think that's really important to keep. We're very different than a clinical therapist, complementary, but different. So our mandate is IDEA, which is access to your curriculum. That is our goal. It's how do we get them to access curriculum, which can mean classroom discussions. It can mean even social discussions, because that is a part of our growth and development in the school. We can look at it that way. But yeah, it has to be access to the curriculum. And are we seeing adverse educational effects from this? So that's our stepping stone, as opposed to, on the clinical side, you get a clinical measure, you have this many stutters per syllable, that puts you in this severity range. It just looks different in the school. And it affects students in a different way in the school. And I think one of the things we also get caught in, if we're going to get stuck with those per syllables per, they come into my room, they see me, I'm a safe space. We have very little stuttering. They go out and about, and the stuttering isn't always overt as well. A lot of it's the covert, it's the insight stuff. And how do we reach that if we can't see it and measure it? And so that was also a part of exploring, okay, I know it's there. The parent reports it, teacher reports it on occasion, students not volunteering in class, but like we can't get a measure on it. So I think that was part of my frustration. And I'm sure I probably missed students along the way because of that, for sure.
Yeah, and Joe, when you said that you wouldn't talk on the phone, maybe do you mind? Yeah, talk. Joe, take the lead here.
Sure. Well, I mean, no, I was the master avoider. I would actually, and this was, I mean, so this would have been college in the 90s, so before cell phones, things like that. But I would literally wait if I had to call somebody, I would wait until I knew they wouldn't answer the phone. And so then I could call because I was able to, and people who stutter are so different. Some people, dread having to leave a message because then their voice is recorded forever. For me, I could talk forever if there's no one there actually listening and there's no time pressure or anything. So I would literally wait till I knew the person wouldn't be able to answer the phone, and then, then I would call them, be like, "Oh, so sorry, I missed you," da 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 da, and then I would hang up. So I just avoided everything. I would avoid presentations in college. I would, if I went to class the first day of class and there was a presentation in the class, I would drop the class and I would add a different class that wouldn't, have a presentation. If it wasn't a class I
Wow.
absolutely had to take. So it was pretty bad, but, you know, in a way, just kind of going back to what Holly was talking about, it wasn't really about the amount of stuttering, that if you have someone who's a student who's stuttering, their stuttering isn't really impacting them with the curriculum at all, right? If they're giving presentations in stuttering and doing different things in stuttering, it's fine. And actually and I'll try to keep this short, but one of the very first clients I ever had in Alabama was a pretty severe stutterer. He was a fourth grader, and he lived about an hour away, and his family would drive an hour to come see me. And one day he was also a fisherman, and he won the junior national championships in the Gulf of Mexico, and he was interviewed live on ESPN2, and the woman interviewing him literally had to pull the microphone away because he was just talking away. He was just stuttering and just talking away, having the time of his life. And that's how he would do at school. He would just talk. And his mom and I sat down and said, you know what? He's a class leader at school. He gives presentations. He's got a million friends. He couldn't care less if he stuttered. And that's a good thing. Like, that's what we want. So, we actually um he stopped coming for therapy, and it was like when he's ready to come, and when it impacts him, because it didn't have any impact on it. So it's not actually the stuttering that's the problem, and especially if you're in the school, it's is he giving presentations? Is he able to do group work? Is he able to order what he wants at lunch? Is he is he getting teased and bullied? Is he shutting down? Does he do these things? But so, like, what's weird is that it's not, therapy in the schools to me isn't actually about the stuttering. It's about sort of all the other things. And so, having a goal, if the only goal is to reduce, percentage of stuttering, you're actually missing the most important part. Because if I'm in school and you reduce my stuttering by 25% or 50%, but I still hate my stuttering, and I'm still not going to talk, whether I stutter on 20% of my words or 10% of my words, it actually has no impact on me. And so, Holly and I had to figure out, well, what is important then? Like, what are the goal? What are the things that we do have to work on? What exactly is it that impacts kids at school?
And part of that is digging in with the students themselves and getting them to dig in and keep, doing that whole client-centered approach where you just keep asking the questions till you get to the core. And you keep asking, okay, if you didn't stutter, what would change? Okay, if that changed, what would that mean? And you keep digging until you can get to the core of what it is. And Joe kind of talked about this a little bit, but, is it the teasing and bullying? Is it the fact that you just cannot order a hamburger on the days when you want a hamburger because it's one of those sounds that you stick on? Are you not choosing to join the wrestling team because you're worried about having to communicate? Or so we were taking it kind of from a different perspective of, where are the life limitations? Where are the limitations at the school? And how do we address those in the goals, but still meet that idea of having those Medicaid billing codes, still meet that responsibility of being able to show progress and growth? So that's where we kind of came together. And, as opposed to that goal, kind of that straight up goal is, Joe will decrease his stuttering by 25% by the end of the school year.
Right.
Over 3 consecutive sessions. So what does that mean though? What does that mean did the child have any input in that goal? Did they care? Did they have buy-in? If the answer is no, no, and no, what are you doing? You're spinning wheels at that point. So
Right. And I love the word you used, impact.
yeah.
What is their personal impact? How is it personally impacting them? That's heavy. I love that.
Well, and that can be hard to figure out. That can take time. One thing that I
Mhm.
tell my grad students is that if you get anything out of, my class in stuttering, it's that children lie and they're liars and you can't believe a word they're saying because, pretty much every kid that you have, does your stuttering bother you? No. Do
No.
so no, I'm fine. Everything's fine. So you
Yeah.
just kind of have to, it's not, I mean, it definitely has to be student centered, but at the same time, if the child says it's fine, but then you go to the classroom teacher and the classroom teacher's like, yeah, he hasn't raised his hand once all year. And then mom is like, this is a huge problem. He can't get words out. Like we have friends when he's got friends over and he gets excited, he can't say anything. And then his friends look at him all funny and then he feels weird. And so, there's definitely a disconnect there. So you kind of have to build that rapport too. Sometimes it can take a little while, before you get that buy-in from kids, because we're just these weird adults, right? That these kids have to deal with and have to put up with, and they're going to say what they want to say. And then so you just kind of have to start by, all right, well, let's sort of practice stuttering and let's learn about stuttering. And then sort of on the way, you build that rapport. And then once you get that rapport, that's when they'll start getting that buy-in and say, this really does bother me. And it would be really cool if I could do whatever.
Yeah. And
Um,
I was going to say in middle school, a lot of times I get that, oh, it's fine. It's fine. It's good. It's good. Until you start doing things like journaling, digging into feelings behind it. And so, that's kind of the other side of, I wouldn't say don't do. Maybe you need to start with the space of education and just doing the feelings work first before you're working on any kind of stuttering modification. I would say that's really your first step, is to dig in and see if it truly is something that is bothering the student. And a lot of times they can't put words to that. A lot of times that needs to come out in drawings, that needs to come out in journaling. And that's a great space for us to step in and do, where we're guiding a little bit more so we can get to those student-centered questions and goals that way. Yeah.
and it's tough. Being in the schools, we get a referral and we need to do an evaluation.
Yeah.
What are some guidance you can give us on that? Because in the perfect world, we would have all the time and we don't. So what is the best way that we can ensure that we aren't just focusing on the, percentage of stuttering and really get a
Right.
better picture?
I think that's where you've got to go with student interviews and making sure that that's a part of it, a student checklist, teacher checklist, and parent checklist. And in the end, if you don't get that percentage, the one thing we have is it is an IEP team decision. And if we feel like there is impact as a team based on all those different impacts or all those different interviews, at that point, whether we got the percentage in the room or not, we can still consider whether there's impact educationally, and we can still move forward. So I think that that's one of my biggest things. Don't be hung up on, oh my gosh, I didn't hit that threshold for severely impact. I didn't hit that standardized number that I was looking for that our district requires. If you document, you can, as an IEP team, decide that there is educational impact and that you can move forward at that point with an eligibility in that communication area. So that is something to remember. Everything is an IEP team decision, even if the numbers aren't quite where you need to see them. So yeah, it is a big thing though. We're told 1.5 standard deviations below the norm, you must have this percentage of stuttering, you must, and if you can grab that piece, excellent. But I really think it's just like with social prag. When you pick up a kid for social pragmatic skills, there is not a good standardized measure for that. I've tried them all. There's not. It really is interview. It's impact. And if we can do it with that area of communication, why can't we do that with stuttering as well?
Well, and just along with that too, that, sometimes just like Holly said, it really can be the paper and pencil things, whether it's the OASIS, the overall assessment of the speaker's experience of stuttering from Yaris and Queasel, or, different checklists, either, the old ones from the Stuttering Foundation of America and Chris and Camilla and Nina Reardon or whoever, but just having something, that really documents, because it could be really hard for kids to answer a direct question as you're looking at them, but often it's easier for them if they're just kind of taking a paper and pencil test and they've got their head down and they're just answering questions. Usually you get more of a realistic picture from that. I mean, I've still had kids completely say, no, everything's fine, when it's really not, even on the paper and pencil test, but usually you'll get a more accurate description then of what they're struggling with.
All right, so let's say, because we are Amazing Speech Paths and we have done a wonderful, robust, student-centered evaluation. We've brought that to our team. The team has agreed. Yes, there is he's eligible. She is eligible. And now what?
Yeah, and so we thought about that as we were thinking about goal writing, as what are first steps? So you've gotten that eligibility, whether that's, a team kid who gets other services or just straight communication. You've gotten that. And so we kind of start, first steps we talked about were small group. And so starting there, to that rapport building Joe was just talking about, is starting in the small group. And I'll kind of give you a goal. I'm going to read off a goal that we kind of use. And of course, that's modified and changed based on the kid you're talking about. But we just said in the small group setting, the student will be able to identify their patterns of stuttering. So their repetitions, prolongations, blocks, and associated feelings. We did not want to dump the feelings in there. So we said, and associated feelings during moments of stuttering in 4 out of 5 trials. Measurable hits our starter within the small group setting. So what is the condition behind it? And gives 2 very structured things you're working on, both the identification and the feelings piece there. Just as kind of a beginning, get them in the room, get them talking to you, and get them just even, I had one client who was the funniest. I saw the note. I'll say the goal again. But I had one student who swore he was not a stutterer, and he's like, I don't stutter. Oh, baby. Oh, okay. And that's where that student was. And that's where you're just like, okay. But sometimes, some of that speech is a little bumpy. So, and just even getting that recognition of, hey, and calling out. Stuttering has been so demonized as, as a disorder, as something bad, as something terrible. Getting past that, getting the parents past that. We are not going to fix this. We are going to work with it and maximize your child's potential. If that is indeed where we want to work and where we want to go. So that's part of it too, as getting out of the business of fixing things and getting into the business of coaching. That's really where it is. I am going to say that goal again, just to respond to the chat. So in the small group setting, which sets up your condition, The student will be able to identify their patterns of stuttering. So whether that be, and I put an IE there for repetitions, prolongations, and blocks, and associated feelings during moments of stuttering in 4 out of 5 trials.
So you could also maybe break that down into 2 goals.
You could.
So that, right?
My thought behind keeping it as 1 is number 1 is a lot easier to measure.
Oh, sure. Yeah, you're
But
right.
my other thought behind that was I don't want to separate out the behaviors that you see and do from the feelings. They're not separate. They are linked and hooked together. And we have to get out of that space of separating the actual behavior, what you see, what happens motorically. We've got to get away from separating that, because really you'll find what's probably holding them back is not that. It's probably what's going on in here. It's probably the feelings that are associated. When this happens, this is where I am. And that's where we start to get our secondaries coming into place. That's where we start to get our avoidance coming into place and all the covert stuff that we can't see. And that's very difficult to measure without a great self-reporter. So that was my thought behind hooking those 2 together.
Okay, thank you. Thanks for explaining that.
One. Yeah.
No, perfect.
Yeah.
That's why I'm here. I'm wanting to learn too. I love it.
Yeah.
So thanks for also saying that again for our listeners.
Yeah.
That's a great first start. Where do we go next?
Well,
Yeah.
and just, if I could just,
Oh,
as a
sure, yeah.
professor, right, I always have to have a model, and there has to be a, sort of an academic model to go from. But, I've really enjoyed, again, the work from Yaris and Kweasel and Coleman talking about the WHO ICF model. And so just making sure that we're hitting all 4 areas of that. You've got the body function and structures. So that is the stuttering and the fluency and the speech rate and all that. Making sure you're hitting activity participation, which it's, the second one, but it might be the most important, right? Are our kids actually participating in school? Are they raising their hand? Are they doing all the things that they need to be doing in group work and classroom presentations? The third one is just environmental factors, right? How do parents feel? How do teachers feel? How do peers feel? Does the child feel like they can talk and be themselves, or do they feel like they need to, hide and mask and pretend that they're somebody else? And just having the whole goal be, if your whole goal in a speaking situation is not to stutter, you're missing the whole point of talking, and a lot of our kids are doing that. And then the last one really is the personal factors. So all those thoughts and feelings and reactions and self-esteem that Holly was talking about. And so this is the WHO ICF, the WHO ICF, and there's been a lot of great work on that from Scott Yaris, just from a stuttering perspective. So it's really a model that the American Speech Language Hearing Association has adopted. And then there's just been some great work on, how that applies to stuttering. And again, just kind of making sure that we're not forgetting about anything.
I love that. I love that matrix when you're using the WHO ICF matrix, because that is a great way to find the impact, especially, and that's what we need to include in our IEP. So I put that in the chat for you guys to check out, because it really does help with function, environment, personal factors. There's 5 and now I'm missing some of them.
Activity and participation is the other one.
Activity and participation, that was the other one. Yeah, thank you.
Yeah, totally. And usually I find too that if you can improve the stuttering a little bit, increase the thoughts and feelings a little bit, and if you can work with the child's environment, that all of a sudden that activity and participation, which is the most important, is going to improve, right? When the child feels like they're able to do something, and then they also feel as if they're supported, or at least, neutrally supported by, teachers, peers, and parents, that all of a sudden I can talk and I can give that presentation and I can ask that question. Because it's so hard if you have a kid in class who really doesn't understand what's going on, but then also feels like they can't ask a question for clarification. They're just going to completely miss everything. Or, if we're going up and down the rows and reading, and I'm, okay, I'm the ninth person, so I count all the paragraphs on my page, and okay, here's the ninth one, and I circle it, and I sit there and I stare at it. I don't hear what anyone else is saying. I'm just so focused on this, and I'm missing everything in class. Whereas, if I was more okay with, I can talk, and if I stutter, that's fine, but if I don't, that's fine too. All of a sudden I'm really able to participate, but also to understand what's going on in the classroom, whereas before I would have just completely shut down and not heard a thing.
Yeah.
Absolutely. I actually had Nina Reeves on last season. She came on twice, actually.
Oh, she's
So
wonderful. That's great.
she's amazing. She is amazing. So those are listening last season, take a listen to her too. So she's got some great insight as well. So first up, I like that goal. It's awareness, not only of the stuttering, but awareness of the feelings behind or during, I guess, really.
Yeah.
So it seems like the first step would be awareness, which is not unlike what we do full stop as a beginning step. Why are we even in speech? I think that, Joe, you said that earlier, like you didn't even know you were going to this little room. She was a lovely lady. But why were you even there until you felt, oh, I'm here because there's something wrong?
Absolutely, absolutely.
Ah.
It's so important to know, and there's really good research in psychology. I don't think we have any in our field yet, but in psychology, is that if the client understands the rationale for what you're doing, they're going to meet their goals a lot faster than a client who does not know the rationale. And I think so often, we've got so many clients we have to work with, and people come in and you work on goals, and the next person comes in. And I think sometimes speech therapists just kind of forget to take that second and be like, do you know why we're doing this? Do you know
Yeah.
what the purpose of this is? Because I think a lot of our kids have no idea. Like, they know they stutter and they know it's a problem, but they don't understand why you're working on what you're working on.
And I'm going to definitely put a plug in that, especially, higher, especially upper elementary, middle school, high school. Please make sure they know what their goals are. I even go as far as to pull their IEP up and say, hey, this is what we're working on. Do you think that's a good idea? Like, it just fosters buy-in there too, and helps them to understand, hey, I mean, this is what it is. We're going to call this elephant out in the room, and we're going to talk about it. And we're going to be super comfortable about it. Which kind of leads to, you were asking earlier about next steps, and next goal kind of leads to that. So I'm going to read that goal out just as an idea, and again, tweak, modify it so that it works for you and your setting and your client. But in the small group setting, the student will voluntarily stutter and demonstrate preparatory sets, pullouts, and cancellations 10 times during a 30-minute session. This is that fluency. That's that traditional fluency shaping. We now can talk about it. We've done a little education behind it. We've talked about our feelings. Well, what do you think? We're identifying it. We're figuring out where the stoppage is. We've gone through the anatomy with them, which, if you like to benchmark, those are all great benchmarks for that first goal. We'll identify the anatomy of stuttering. We'll be able to figure out where in their system they're having difficulty. So if you like to benchmark, you can totally benchmark by using those things. So now we're ready. Hey, let's try some of these. Let's put some tools in your toolbox. Maybe you'll like them. And I'm pretty straightforward. Maybe you'll like to use this one. Let's try it. Maybe you won't like this one. If it's useful, let's use it. Here are some things you can try. I don't hang my hat on this goal as the end all be all though.
Would you say that goal one more time?
Yeah. In the small group setting, the student will voluntarily stutter and demonstrate preparatory sets, pullouts, and cancellations 10 times during a 30-minute session. They can tell you what they are. They can show you. Then at that point, you can dig in. Hey, is this something you'd want to try outside of this room? Is this something you would actually use? But the big thing for this too is that idea of you can change and modify how it's coming out of your body. And here are some ways for us to practice changing and modifying how that's coming out. We don't have to be stuck with one way of producing each. It doesn't always have to feel like that. So can you go speech and be able to keep that air flowing? So you didn't necessarily go for fluent there, but you went for modifying and shifting productions. I think that also gives a sense of control back. Like, yeah, you know, it doesn't have to be one way. Joe, you can kind of talk to that from the personal, having practiced all these and used them.
Yeah, absolutely. And just, you know, in case people, you know, we probably have people that know a lot about what we're talking about, and then people that this might be new to. So, a cancellation would be actually a post block change, so that if I'm stuttering, I'm gonna stutter. I'm gonna finish the word, pause for a second, and then I'm gonna say the word again in an easy stutter. I'm not gonna try to say it fluently, but I'm gonna try to say it again in a nice, easy stutter. And then, you know, it's a great thing to have kids, you know, practice to voluntarily stutter. So stutter on purpose, pause for a second, and then practice making a nice, easy stutter with it. And then the second one, you know, traditionally it's been called a pull out, but you can call it a slide out or lots of other different things. And what that would be, that's really like a mid stutter correction. So pull out is where I'm actually going to change my stutter right in the middle. I'm going to slide out of it, make it really easy and smooth. And then the ultimate goal would be the preparatory set, where you're going to have this nice little easy, relaxed stutter right from the very beginning. And it really, honestly, it turns into basically an easy onset. But the big difference here is that, you know, we're not doing it to try to hide the fact that we stutter. We're trying to just have a nice, easy sort of transition, and easy moment of stuttering, forward flowing moment of stuttering, not pretending that we don't stutter, you know, but learning how to stutter more easily. And just like Holly said, I mean, anything kids can do to just change the way that they stutter. So if I mean, I'm a big, and you know, I was a big and still do have a lot of blocks. And so if I can turn those blocks into a prolongation, or if I can turn it into a repetition, I'm getting it out loud, I'm breathing, I'm making sound, like I'm doing all these positive things, rather than when I'm blocked, there's nothing, there's no air, there's no movement, there's no anything. So, you know, just helping kids to change their stuttering, and then to stutter in an easier way, and to just start feeling like, oh, like I don't have to stutter in the same old way every single time. I've got options in the way I can stutter, and options in the way I can talk.
Okay, so I'm going to do a little recap, make sure I have this. So first steps, if we're running, and of course, this is not your child, your student centered, but if we're like me, I would like to have something to go on, and then I can mix it up. So this really helps me. So first, we start with the first step is that awareness step, y'all. They're talking about awareness of the stutter itself, the speech mechanism. And the most important part of the awareness, not only, right, your speech mechanism, the stuttering, but most importantly, the awareness of the feelings, because that's really that's the impact, is the feeling behind it. Absolutely. And then the second part, you said it way more eloquently than I'm just gonna do it short and sweet, is voluntarily stutter to find other ways to make the actual, because we're not here to stop stuttering. I think we all need to hear that, but to make the stuttering easier. And so awareness. And then the second is to find when you start voluntarily producing a stutter and finding another way to stutter. That's great. All right.
Yeah. And then we're also at that point, we're desensitizing, right? Because we're finding different ways
Yes.
to stutter. We're not necessarily after fluent because maybe
No.
that will never happen for you.
Mm-hmm.
So cool. But you can still be in control and in charge of what's going on. We have 3 more goals I want to share.
Oh,
I'm going to
yep.
kind of go through those because this is the good stuff.
Oh, yeah, this is what we want. Yes, keep
Yeah.
going.
And then I'll let Joe chime in and add, and we do, if we have time, we do have a really cool case study we want to share with you.
Okay.
That just kind of really ramped up our discussions around this. I can add these in a little bit, but in the school environment, so there we set up our condition, the student will voluntarily stutter. So now you've practiced it, right? What does voluntary stuttering look like? You've already gotten that in the small group. So the student will voluntarily stutter to 3 different student selected people. And I actually have a student right now. This is his goal. So the student decides his 3 safe people outside of my room and 3 unfamiliar people. So maybe a teacher or one of our cafeteria people or a paraeducator, maybe he doesn't know, and 3 peers. So it's very easy to check off, very measurable. So 3 different student selected people. Those are safe people. Those are teachers. Those are best friends, whoever. 3 unfamiliar people in the school, and then 3 peers. So a lot of times they'll choose safe teachers, which is why we want to add that peer communication in there. And this is where we start to do peer education. This is a
Okay.
chance for that student to come in and to address being wide open. Just like, Joe advertised right from the beginning, I'm a person who stutters. I try to advertise from the beginning, I'm a person with dyslexia. So if we can advertise those things and take the stigma out of them, we get to the so, and there is no teasing or bullying when you're like, yeah, what's wrong with you? So that's why we want to incorporate the peers. I'm going to keep going with the next 2, and then we can have discussion around. In the small group setting, the student will identify, this is where we're digging in. This is now time for the student to start digging in and making those student-centered goals. We've kind of directed and guided. Now we're getting in there. In small group setting, the student will identify 3 impacts of stuttering on their participation in school and design action steps to address the impacts. And this will vary by student. It'll vary year by year. It may vary quarter by quarter. Their action steps, as they get more confident, they may check off their action steps and be ready to tackle harder and harder situations. So this is where the student drives. So now what? You've got techniques. You can voluntary stutter. We put you in some tough situations. You've mastered those. You've got through those with both safe and people maybe that you're a little more fearful with. So what's next? So what does this all mean? Do you want to use it? Is it important to you? And this is where you can start really digging in with them. And then I want to give the last goal kind of on our journey. This is also a goal I have for a student currently on caseload. By the end of the school year, the student will create and then give a presentation about stuttering in a class that the student selects. We keep that safe space. And this kind of came up in a really cool way. If you are in with your science teachers, and especially the ones doing the biology units, when they get into biology function, your student can take the respiratory system. And once they take the respiratory system, they design their presentation around the bodily physiology from here up and include the speaking mechanism. And then they get to do peer education in a big way with an entire class. And they get to talk about where things can get difficult with speaking and how it affects them. So then we've got some huge advertising. Hopefully they'll throw in some stuttering moments during this. So this is where you're integrating all of it, right? You're making it a big picture, which is why we put that as a last goal and one of the most challenging goals for students. And that kind of like started really driving our conversations is we have a student that both Joe and I worked with, Matthew. This is my kiddo who's like, I don't stutter. Oh, okay, Matthew. Yeah, okay. Yeah, I mean, I don't know why I'm here. Oh, all right. Well, you know what? Let's just start digging in and what are different ways that other people stutter, even if it's not you. Let's talk about it. And hey, look, this is how, this is how I stutter. And if you are going to work with students who stutter, become a really great stutterer. Because
Okay.
you're going to need to out stutter them. That you are going to need to challenge. No, I think I stutter better. And watch this. I'm going to go into that office. And part of that, when you guys are starting, like getting outside of the room, part of it is just having them watch as you do it. That's a part of that desensitization. Can they even be around stuttering without freaking out? So you definitely want to make sure you have that moment first before you're putting them in the situation where they've got to do the hard thing. Is if you're not willing to do it and you're not a really good stutterer, why would they want to go out and do that? So we spend several weeks of just, no, you're coming with me. I've got to go talk to Mr. Pageant across the hall. And oh, I feel like I'm going to have a good one this time. And you do the thing. And you can do that how you want to. I tend to just surprise teachers and just do it. I don't preset it up. But you can go in and say, hey, I've got the student, we're working on these goals. I'm going to come in and I'm just going to stutter. And I like natural reactions because then we can go back and debrief and be like, whoa, did you see his face? And he told me to slow down, or he kind of looked at me funny. That kind of made me feel weird. And so then I can talk about it from my perspective and hopefully get them start talking about their feelings too.
That is great. Do you mind, I know you just gave us the fourth and fifth goal. Do you mind writing out the fourth goal in the chat?
Yep.
Because I think you've got the three.
Yeah,
You did the
I
first three.
I can get those in there.
If you
Yeah,
would do that, and do you mind if I ask, we had a couple of questions.
sure.
Donna was asking, this is when you're follow up about what you were just saying about when, I think Joe, when you were talking about changing the stutter, she's asking, would you ask them to change the stutter every time or just on the voluntary ones?
It's really student and time dependent. Like if we're working on this and practicing this, like I'm going to want my kids to put in a ton of stuttering and change a ton of stuttering. But then, if we're not working on that, then no, they don't have to do it at all, right? That the goal, I mean, we don't want to make this miserable either for them either, right? So we want to kind of start out slowly and okay, we're going to work on this, so we're going to practice this, right? But then all of a sudden, if we're now, taking a moment to work on attitudes and feelings again, then you can talk however you want to. And we're not going to worry about, the different techniques or more stuttering or less stuttering. But I do always want to tell them, as we're in therapy, like, hey, like we're in here for stuttering, like I need you to be stuttering. Like if you're not stuttering, we're not getting it any work done. And that, at first kids are always like so confused by that because they've never heard anyone ask them, to try to stutter more. But it's like, no, like we can't do anything unless you stutter. We're just wasting our time. So like I want you to stutter, and then I want you to, let's start stuttering in different ways, and let's, change it after the stutter, let's change it during the stutter, let's change it before the stutter, and practice all these things. Yeah, but then just getting to that question, right? If we're not working on that, I do, right, there has to be time, and we have to be a part of those people, right? That it's okay to stutter. The kids have a safe place. They can come, they can stutter, they can tell me that they, had a terrible morning and that, you know, they were expecting to be called on in class and all of a sudden they were called on and they couldn't get anything out and they heard some kids laugh and they're feeling terrible about it. So, right, it can't all be about speech, but that when we're working on it, I want them to do it a lot. Carolyn, if you want to share our emails. People are
Yes,
welcome
I
to send us
do.
emails, and we've got a presentation that we did at ASHA that has all these, all these goals on it and all this information. We'd be happy to email this out to people.
Holly, do you mind? We had another question for working with our littles. Is there a better way, or a not better, another way, or other words? She was saying, sorry, I'm trying to remember who it was.
Bumpy
Daniel.
versus smooth. I think I
Yeah.
saw that.
Yeah.
Yeah. Joe, you went to one recently that was for the little people, about directly addressing stuttering. We used to talk about it needed to be parent education, and it needed to be, you were sidestepping constantly to see if they would spontaneously, quote unquote, recover. And then we're back into that fix it mode, right? Is there better terminology, or are you guys, is it still bumpy smooth?
It's really up to the child, up to the family, up to you. We have a 3-year-old we're seeing now, and we just talk about stuttering. Like, oh, that was stuttering. That was a lot of stuttering. Let's try to stutter faster. Let's try to stutter slower. Let's try to stutter, long. Let's try to stutter short. Let's try to stutter in all these different ways. And it's always okay. However we talk is totally fine. And sometimes some people stutter, and that's okay. It's not a big deal. And it's important to be able to talk about it. And so, we have a little 3-year-old, she runs around here, and we talk about princesses and stuttering. And she has, we've got some great grad students here, and they've made um, like full body princess pictures, and she pretends to be different princesses and stutters. And how would Ariel stutter? How would the people from Frozen stutter? And how would they do this? And we just talk about it, and we make it okay, and that everybody talks a little bit differently, and some days we'll have more stuttering and some days we'll have less stuttering, and it's totally fine. And that's really important. And that you know I was at a great presentation at the last ASHA conference from Nan Bernstein Ratner, and she was saying that we honestly don't have good evidence that anything we do with preschoolers is going to stop their stuttering. That it's really a lot like what we do with school age kids, that we can, improve their quality of life, improve their knowledge, improve their communication skills, improving everything. So, again, just kind of getting back to the idea that, maybe, and we do know that if kids are going to stop stuttering, about 75 to 90% of the kids who will stop stuttering are going to do so within the first 3 years, just naturally. So, if they're within 3 years of onset, there's still a really good chance that the stuttering will go away. But yet that can't be the focus, right? If we're telling parents that we're trying to get the stuttering to go away, and then the stuttering doesn't go away, like, what message have we sent, and what are we doing? So it's so important to start right from the beginning that this is okay. Who you are is beautiful and fine and awesome, and maybe you'll stutter and maybe you won't, and we don't care, but you can be an awesome talker, awesome communicator, and have an awesome life, no matter however you talk.
And I do want to say, I know we're out of time, but I do want to respond back to one thing's in the chat about parent education and and this happens at all grade levels. I see this was particularly high school. If you have an older student, upper middle school, upper elementary, middle, or high, sit down in front, have the student at the IEP meeting. And if it is the parent who has a problem and not the student, because that happens a lot, if it is the parent that has a problem, I will look directly at the student and go, do you even want to work on this? And because then I'm the buffer, right? I'm the buffer for that parent-student conversation. And at that point, you're showing the parent that it is now their goal. And I would say, if you're just getting them at high school, you're in a tough spot if your speech therapist hasn't had the real conversations prior to coming up. But for all of you that are serving younger students, please start having those real conversations like what Joe was just talking about. Hey, your child may stutter, but hey, we're going to try to maximize their life and their communication to the best of our ability. But in middle school, I start looking at the students. I do not look at the parents when I hold an IEP meeting. because this is not about them. This
I
is
think-
about what the student's willing to do.
Right. So I know we are getting to the end of our time, but could we end with like, I think you're leading into dismissal, because as you said that, I believe that if you were continuing to stutter into adolescence, the chances are you are now going to always stutter. So at what point can we look at dismissal?
Yeah, I think especially at the high school level, when the student tells you. At
So-
that point, I mean, maybe you can hold them through middle school and fight the parent battle at that point. But I start having the conversations in my private sessions with the students where I say, how are you feeling about this? Is this something, and this is also, you talk about this when you have the carryover R student, right? Who's been birthed to death and they're still,
Yeah.
still working on the R. But I start to look and say, how are you feeling about this? How are your parents feeling about this? Hey, do you need me to have that conversation with you, with your parent? Because hey, parent can get, I don't have to live with the parent, right? I don't mind having tough conversations with the parents and saying, your student really, at this point, may need a break. We've been doing this a long time. We're not moving forward at this point. This is not a forever end. This is right now. The student does not want to step up. Your student ultimately has to step up and swing the bat. I can only coach. And if your student's not willing to step in and do the participation at this point, cool, let's take a break. We can always come back to IEP. We can always come back to the referral when your student's ready. And I think sometimes if parents know that it's not a forever decision to dismiss, they can take that breath. It's okay. We're not giving up. We're saying right now, this is where we are. And if you can ask that student directly in front of the parent and be the buffer zone for them, if you find that it's something the parent cares about more than the student does, that's a great role. Take one for the team, take one for your student at that point.
Could you also speak to possibly, would there be a time where that the students on board, they have their toolbox, they're actively participating. Is there a time that we'd say, actually, when we can show they're actively participating in their education? I guess as a clinician, I'm scared that I'm going to miss maybe that feeling portion, that I don't want to miss that. Is there a way to make sure that we're like, they are ready, they have all the skills, what do your views?
I'm going to go back to that last goal. Have
Okay.
you done a culminating project where you've brought all of that together and they are wide open and they are really comfortable and they're feeling good enough that they can actually do this in front of other people? Whether that, maybe your student can't speak in front of large groups for the same reasons that anybody else can't speak in front of large groups. Yeah. But are they open and advertising and willing to talk to you, or is there still hesitancy within that? And you will use your clinical judgment. You will know when that student's ready. And most of them, if they're really comfortable, will have told you. They will have told you at that point. Unless they're using you as their emotional support speech therapist, which does sometimes happen. And then you've got to have real conversations with your students, right?
Joe, can you leave us with some final words?
Well, I just think that, it can be so hard. A lot of times I think stuttering is a grown-up disorder that kids have to deal with. It's pretty easy as a grown-up to be able to stutter and be like, oh, I stutter sometimes, and that's the way I talk. And then if you don't like the way I talk, that's a you problem. It's not really a me problem. But that's really hard for a 9-year-old, right, to figure that out and to feel that. So just the more we can help our kids feel like, hey, I can take some ownership, I can have some agency, and if I've told you that I stutter, either through a presentation or just in a one-on-one, and you're still making fun of me, that is a you problem. It's not a me problem. Like, this is just the way I talk right now, and I have to live my life. And that's, and that everybody needs to be okay with that. And if you're not, again, it's not my fault. And I think that if we can do that for our kids, we're going a long way.
Advocacy.
Yeah.
Self-advocacy.
Yeah. Yeah.
Love it. I'm not sure an hour has gone faster than it has today. Thank you so much. I really, really appreciate those goals. Those that are listening live, that's in the chat, and that will be in the transcript for those that are going to hear it after today when it goes on to other platforms, that they could, I think that's gold. That was gold for us. Thank you for sharing your emails and being open with collaboration. I really think that technology is really bringing us all together, and sharing our goodies with everyone is what we want. We want all of our students to get the best therapy and that they can. So thank you so much for sharing. As we end, I just want to say thank you, Holly. Thank you, Joe, so much. I'm going to say goodbye to our guests and thank you so much. Love to see you on again. Oh, wait a minute, guys. Before we go, I have to talk about next week. I need everyone to come next week because we have Holly coming back, and we are going to be talking about navigating school-based therapy in the middle school, which I think is one of the areas that we don't get a lot of PD on. So if you loved today, you're going to love next week. So I need everyone to tune in next week, and Holly and I will be back. But other than that, I'm going to say bye, y'all. Bye. Thanks, Holly. Bye, Joe.
Next
Thanks,
Thank
week.
Carolyn.
you.
Thank
See you
you.
next week, Holly.
Bye.
Yay.